Good afternoon and welcome to the PET, Professional Educators of Tennessee webinar series. Today we're talking about the basics of long-term care and the issues surrounding that. My name is John Green with Association Member Benefits Advisors. I'm joined by a couple of the staff members from PET, Bethany Bowman and Kaylee Jocelyn. And so thank you for joining us today. Just a couple of quick reminders for those who are joining us. All participants are in a listen-only mode, which means that if you have a question or you want to just ask something or even comment on something, feel free to use the chat or the Q&A feature, and we can answer your questions throughout the conversation today. We do record all of these webinars, and we make them available on the PET YouTube channel so that you can follow up and watch them at a certain date, share them with a friend or family member, something like that as well. You'll also notice a QR code in the bottom right-hand corner of this screen. We'll have it at the end of the conversation as well. It's a great way to get more in-depth information by simply taking your smartphone, opening up your camera feature, just like we do in restaurants today, hovering over the QR code, and then a little form will pop up. You can ask specific questions about services that AMBA and PET offer to their members, and we'll be glad to get back to you as well. So grab a pen and paper for today's webinar. We're going to cover a lot of different issues, but before I do so, I want to bring up Bethany Bowman to talk a little bit about the Leader U conference. She is a director of professional learning with PET. So good afternoon, Bethany. How are you today?
Hello, I'm doing well.
Great. Tell us about Leader U and what it is and how people can get involved and register to become attendant.
Leader U is the name that we have for our professional development segment of our association. And we have two different branches of Leader U. We have the in-person Leader U, which we haven't got to have for the past 2 years. And so we're back to having in-person. It's a day of professional development for all Tennessee administrators and teachers, and even student teachers can get some knowledge from this. It's a TASL accredited event, which means it's approved by the Tennessee Academy of School Leaders. And it'll be the in-person event will be June the 7th at Middle Tennessee University in Murfreesboro, Tennessee. The thing that makes it unique is that there's lots of options. Leader U meets and it has 12 different classes. So you can pick the 3 or 4 that meet your needs the best. And even on top of that is the networking. People like meeting with other like-minded associates, whether they be teachers or principals or even college professors. They like meeting with people who think like they think and, are on the cutting edge of doing what we feel is, the best thing for students. So hopefully people will learn. But what we do also that's a little unique is we record every session that we have. All these, what I call top leaders in the field of education, we record their sessions and we add them to an online portal. And some of the people do Leader U in person and then do some on the online portal, and some do all of one and all of the other. But it's available. It'll be available to anybody who wasn't able to attend in person can watch the video a little later on and get credits that way. And because of what we do, we've banked and created a library of events, and we do review them every year, but as long as they're still current, we keep them. And now we've got over 100 online classes available, also under the Leader U umbrella.
Outstanding. You mentioned crediting. So because it is accredited, they get credit hours for professional education?
In the state of Tennessee, districts are in charge of whether they approve a teacher's credits or not, but the state approves the administrator credits, and I have gotten approval from the state for the administrator credits. I'd say 95% of the time, if the state's approving it, then the district will also approve it, but I can't speak for each district.
Okay, great. And so how do they register to attend?
All they need to do is go to our website. It's very easy, www.leaderutn.com, leaderutn.com. There's also a link off of our ProEd website as well.
Outstanding. Well, thank you very much. We look forward to having a good group. It is good to be back in together again, to be able
to meet.
So anything else you want to share with the group, Bethany?
the main thing is I live in Nashville and I've been to a lot of events lately, and people are just desperate to talk to people, to even touch them and shake their hand and hug them. It's just like you didn't appreciate it like you do now.
Exactly, exactly. Well, I hope it goes well. I know that Amber will be represented there as well. So
Yes.
we thank you for the opportunity to sponsor that event. So again, if you've got questions, again, go out to leaderu.tn.com or org.
It's at leaderutn.com.
.com, and all your registration questions will be answered out there, and Bethany will be glad to answer anything else that you've got. So Bethany, thank you for joining us this afternoon. We appreciate what you do for our educators in the state of Tennessee.
Well, and thank you, Amber.
All right, you're welcome. Take care. All right. Just a quick reminder, my name is John Green with Association Member Benefits Advisors. I live a little bit north of Houston with my wife, who is a second grade elementary school teacher. She teaches in the same school that she went to elementary school, as well as my 3 kids went to elementary school. My career, I've spent most of my time with active educators, helping them understand what their retirement is going to look like once they leave the classroom. And that's kind of how we work with PET, to help you understand what your retirement is going to look like, but also help you while you've got your teaching years. And we appreciate that. PET is extremely involved in the state of Tennessee to make sure that you have impact in your classroom, impact in your career, and impact after you leave the classroom. PET prides themselves on being nonpartisan in their advocacy, regardless of which side you choose. It's all about educators and the education community. Their goals are to help you preserve pay, classroom environment, and health benefits that you work so hard for, and keep you connected to like-minded educators all across the state. Bethany just gave you an excellent opportunity with Leader U of this opportunity to get back together and not only learn from top leaders across the state and across the country, but network, further your career, that type of thing. That's what PET does on your behalf. And then to partner up with AMBA to make sure that you have discounts, benefits that you may not be able to get access to in the schoolhouse or after you leave the schoolhouse as well. Just a little bit about AMBA. Association Member Benefits Advisors has been around for over 40 years. We're based in Austin, Texas. We serve associations in about 42 states across the country, about 75 associations. Most of them are very similar to PET. They're active and retired educators, active and retired state employees, firefighters, police officers, nurses, what I like to call the public servants of our country, people who have taken their career to serve others. And in turn, AMBA turns around and makes sure that you're taken care of and served as well. Our leader in the state of Tennessee is Eric Cannon. He's a native of Tennessee, and he's glad to serve you and he and his team all across the state. If you have questions, any needs that you have, can come to your school, do webinars, things like that, to make you aware of the PET benefits so that are out there for you. And some of those advantages of having PET and AMBA together is that you can fill the gaps that aren't covered by your state or your district benefits, whether it be because the school doesn't offer it or because there are some gaps maybe in your medical plans and things like that as well. They're portable. If you leave the state or if you leave your district employment for whatever reason, you can take these benefits with you. They're not tied to your district. They're not tied to something that's a benefit from where you're employed. But one of the biggest reasons that many members tell us from PET that they like having benefits with AMBA is that they can extend those benefits, those PET endorsed benefits, to their family members who may not be eligible for your school benefits. So think about this 2 different ways. It could be that you've got an adult son or daughter that is aged out of your benefits through the school. You can extend your PET eligible benefits to them and make them aware and make them eligible for your benefits and take care of that way. Or more than likely, what we see oftentimes is that a member will have their benefits extended to their parents and provide coverage in certain areas that maybe their parents don't have. And so it's a great way to possibly prevent you having to take extended time off from your career to take care of a loved one if you provide the proper type of benefits for them. So we're going to talk about that today. We're going to tackle this whole conversation about long-term care insurance, what that means. And we're going to jump in and kind of discuss this and discuss kind of the myths and facts surrounding long-term care, We're going to talk about the need for it, whether it's for you or for a parent. We're going to discuss kind of the traditional components of a long-term care policy, because many of you may have access to a long-term care plan through your school, or your parents have purchased one in the past. We're going to kind of break down those components a little bit, talk about the cost of waiting, maybe some potential solutions, and the impact that it can have on you for generations, whether you or your parents need some type of long-term care, and help you make the most of your endorsed PET solutions that are available to you. This is the reason why I give this webinar. I'm so passionate about this topic. This is a photo of my father and I back in July of 2020 at his memory care facility in Austin, Texas. This was the last time that he remembered who I was. He passed away after about a 2-year bout with dementia in October of 2020, and spent the last 19 to 20 months of his life in 2 different long-term care facilities. We were blessed that he had the foresight back when he was in his early 60s to take out a long-term care policy. And I want to have that conversation with you today to show you how it does impact not only the person receiving care, that's my father, but how it impacted my stepmother, my brother and I, and for future generations as well. So as you, as an educator, as an active educator, which most people on this conversation are, you're kind of in that middle position like I was. You have a career, you have a family that you're taking care of, and you may be responsible for an elderly parent. So this conversation is geared not only towards you and your future planning, but thinking about how you would take care of your parents as well. Because protecting your future goes beyond just taking care of your needs. It can go as far as taking care of your parents' needs, or an aunt or an uncle, and it could be your children as well. I've seen many situations to where the need for care of a parent has impacted a marriage, which impacts the kids, the grandkids, holidays, things like that. So it's important to us at AMBA and PET that active educators understand that long-term care goes beyond just taking care of the need of the person receiving the care. It impacts the family up and down the family tree. I love giving teachers pop quizzes because I got pop quizzes all throughout my educational career. So grab a piece of paper and answer true or false to these 6 questions. True or false, long-term disability and long-term care are the same thing. True or false, very few people need extended long-term care, or that people only over 50 need long-term care. True or false, long-term care is the only type of option that's out there in a nursing home setting. True or false, Medicare just pays for everything, and I should wait until I'm retired to make a decision. If you answered true to any one of these questions, that is incorrect. False is the answer in each one of these situations. We're going to kind of explore that as we go through here. Many active educators that are on this call today probably have some form of long-term disability through the school. The school either provides it for you, you have access to it, and you purchase it, something like that. That is a great plan. You're ensuring your paycheck, but that really doesn't consider long-term care in the long run. And usually it stops once you become Medicare eligible, or once you start to receive Social Security, something like that, or some sort of disability payment, something in that situation. We're going to address all of these other situations as we go through here and show you kind of why you need to think about planning now for the future for yourself or for your parents there. Because the fact is that 70% of individuals, once they reach age 65, are going to need some form of extended care sometime in their lifetime. And it could be extended care in the situation like my father, where the last almost 2 years of his life were spent in 2 different nursing homes, memory care facilities, or it could be a situation to where somebody has a slips and falls during an ice storm, or has a knee replacement surgery and needs care for 3 or 4 months. So just because we talk about long-term care, it doesn't have to necessarily mean nursing home only. It could mean extended care of some sort to where you can't take care of yourself. Let's kind of look at the current realities in long-term care right now and just use this as a gauge to see what may be my needs, what may be that I need to plan for out there. The average person spends 28 months in an assisted living facility. And we're going to talk about different types of places that you can have care for. But think of an assisted living facility as kind of that middle place between home and a true nursing home. An assisted living facility is somewhere that you have your own private residence. You can provide for yourself, or you can go eat in the dining facility. There's activities, things like that. But if you need some sort of someone from a medical perspective to come in and check on you, or maybe someone that comes in and provides some sort of cleaning or light housework, that's an assisted living facility. 28 months is the average amount of time that someone spends in an assisted living facility. And then nearly 60% of those individuals transition into a skilled nursing facility or a nursing home, for lack of a better term there. The average stay in a nursing home is 2.2 years, but that varies based on whether you're male or female. A man usually spends about 8 months in a nursing facility. A female will spend about 2.5 years in a nursing facility. My dad, because of his dementia and is otherwise in good health, spent far greater than average man in a nursing home facility. What usually happens is that the man will stay home and the wife will take care of him as long as she can until she can't do it any longer. Then he'll spend the last few months of his life in a nursing facility, and then the woman is wore out, and then she has to go into a nursing home facility at that point. But what we're seeing these days as well is that Alzheimer's is causing people to stay in a facility in a much longer period of time, because usually their health otherwise is fine. It's purely a memory issue. So if you've got a history of Alzheimer's in your family, 9 years plus is an average stay in a nursing facility. And that can be quite expensive. We'll talk about that in just a moment. But the one stat that jumped out with me, and I want to share with you this, I want you to write this down: 100 days, because that's really important when you're thinking about yourself or your parents. 100 days. Almost half of all nursing home residents stay less than 100 days in a nursing home facility. And it's not because they go there and then they pass away almost immediately. It's because of the Medicare rules and the expense related to nursing home care. And we're going to talk about in a moment kind of the myths surrounding Medicare and nursing home care and long-term care with Medicare, so that you're aware of this, so that you can have this conversation maybe with your brothers and sisters regarding your parents, or if you're close to Medicare eligible, understanding how it could impact you as well. But before we do that, let's kind of look at the traditional components of a long-term care policy. Many of you on the conversation today may already have a long-term care plan through the school. Your parents may have purchased a long-term care plan through maybe their place of employment in the past, or individually a long-term care plan. We're going to look at the components kind of in the analogy of a good hamburger, because to qualify for long-term care or to go on claim, if you have a long-term care plan, you have to have a qualification, and it could be the activities of daily living, meaning that you lose 2 or 3 of the abilities to either bathe, toilet, dress yourself, feed yourself, transfer out of a bed into a chair into a bed, something like that. If you lose 2 or 3 of your activities of daily living, most policies then start the clock ticking on your benefits at that point. The other qualification that could qualify you for your long-term care benefits is a cognitive impairment, such as dementia or Alzheimer's. In the case of my father, dementia was what qualified him for his long-term care plan that he had taken out many, many years ago. Once you have either one of those, activities of daily living loss or a cognitive impairment, your long-term care plan then at that point kicks in, for lack of a better term. You go on claim. Then you start looking at the components of a long-term care plan. Most long-term care plans, the meat, the thing that you're purchasing is your benefit amount. And they're broken down into 2 different categories. There's usually a daily benefit amount that would be $100 to $300 a day for your long-term care benefit, that said once you lost an activity of daily living or were cognitively impaired, you would start to receive that daily benefit amount for your care. Some plans had a pool of money that said you've got $100,000, $200,000, $300,000 to use for your care. Then you have a length of coverage provision. Now, if you had that pool of money, It basically said you've got this pool of money to use for long-term care up until you exhaust that pool. Once you exhaust that pool, whether it goes out in a year, 2 years, 5 years, then you're out of money. Other plans that have the daily benefit amount, it could be 3 years, 5 years, 10 years, or lifetime of the individual. Those are the two type of plans that were out there. If you purchased a group plan or you have a group plan through the school, more than likely it is a pool of money plan. But it's important to understand that, have someone review that with you. We'll show you how to do that in a moment. Then there's an elimination period. Now, an elimination period works just like your deductible on your homeowner's policy when a storm rolls through Tennessee, a tornado or a hailstorm, and damages your roof. You've got the first 1% or 2% of your home value that you have to pay out of your pocket to pay for before the insurance company pays for the repairs. The elimination period works very similarly with a long-term care plan that says you have to pay the first 90 days of your care, or the first 180 days of your care, and then your policy is going to kick in. What that does is it helps keep your premiums low, or lower, I should say, by having a bigger elimination period. We'll talk about some of the bugaboos that run into that, depending upon what your elimination period is. Then you have location of coverage. Most traditional long-term care plans have coverage in a nursing facility and some type of home-based care built into their policies. They may vary the amount of coverage that is provided for the home-based care, but they have care in both of those places. Some will say assisted living facility, some will have some more definition around that, but location of coverage is very important in most plans. If you have a very inexpensive plan, it may exclusively be in a nursing home, or it may exclusively be for home care, but not nursing care. So it's important to understand what those care locations are. Then you get a couple of what I call riders on top of the policies. These are optional benefits that you can purchase for an additional amount. One is an inflation protection that adds a simple interest or a compound interest on your benefit amount every year so that it keeps up with the cost of inflation of the care. Some of these policies will have an option that says you will be offered the opportunity to buy up your coverage every 2 years. And if you take that option, great, it'll cost you a little bit more without any type of underwriting, without any type of qualification. And you can do that and continue to buy up. But if you decline those opportunities to buy up your coverage twice in your policy period, you can no longer get access to buying up that coverage. So it's important to understand that. And in some policies, very, very few, some have coverage for non-skilled services. And think about this from a non-skilled service perspective. If you or your mother or father have to have someone come in to do some cooking or light housekeeping, or in the case of my father, my stepmother needed someone to come in at night because she still worked and just basically stay up so that my father was not a risk at wandering off or falling and hurting himself in the middle of the night. Didn't require a home health aide or a nurse, but just someone to pay to stay up to take care of, make sure my dad didn't wander off. That was covered under his plan under this non-skilled services provision. So those are the historical components of a traditional long-term care plan. If you have one of those, it's important to pull it out and review it periodically. We'll talk about how you can do that with AMBA here very shortly, but I applaud you for taking the proper step early on to prepare for your future plans. So let's kind of define extended care. We've touched on it just a little bit, but extended care is much broader than the old traditional, I'm just going to go to a nursing home and spend the rest of my life there. Extended care means care in your home after you recover from maybe a fall or a surgery or a heart attack or cancer, something like that. It could be care in a nursing home or a long-term care facility based on memory care or other traditional nursing home cares. What we're also seeing is this kind of hybrid community. They're called continuing care communities, and they're popping up all over the country. And there are quite a few of them actually in Tennessee, and then as you go further south because of the good weather. But they are places where you can purchase your place of residence, for lack of a better term, be it a condo, be it a unit, whatever it is, tiny home, house, whatever it is, you purchase that. And for one set price and then maybe a small maintenance fee throughout the years, you then can enjoy the benefits of the activities, the food, and as you need continuing care, as maybe one of you in your family, you or your spouse, has to have someone come in and maybe do some wound care or some physical therapy or a little bit more than just a normal care if you're sick, then you've got that progressive care, but it allows you to stay with your spouse or with people in your community. Some of these are centered around church organizations, some are centered around fraternal organizations. There's one in the state of Texas that is exclusively centered just for retired teachers. So there's kind of cool the way that these communities are coming up. There are dozens across the country that are actually tied into college communities. And so they're almost continuing education and continuing care communities as well. They're really neat. So I encourage you to take a look at those. But extended care goes beyond just putting someone in a nursing home and never thinking about something else again. So extended care does run out there. Now, people always ask me, well, how do you pay for extended care? Because it's so varied out there. There are 4 different ways that you can pay for extended care. You can pay for it out of your personal assets and your personal savings, the things that you've saved up for all your life, or your pension, or your 403b, 401k. You can pay for it that way. Most people rely on assistance from friends and family. And I don't mean putting out a GoFundMe out there that says, hey, help me with my long-term care expenses. I'm talking about someone in your family, or it could be you, that has to quit their job to take care of mom or to take care of you. A few people enter into the Medicaid program. We'll talk about that in just a moment. Very difficult to qualify for, especially for educators once they get on their pension. And then the other alternative, which gives you a much more control, is extended care coverage. But you don't know who needs it. That's the thing about long-term care. We talked about 70% of individuals over the age of 65 were going to need some form of extended care in their lifetime. We don't know what the future holds. As we age, you start to lose the ability to do things that you used to do with ease. I've noticed this with my mother, who turns 81 here in May. She forgets a few things. She repeats herself quite frequently. She's still able to drive. She's still very active in the church with all her friends, all that kind of stuff like that. Lives by herself, not a problem. But my brother and I were just discussing, we're starting to see that she needs more help than what she used to in the past. And then because of accidents, we're seeing people much younger need long-term care services as well. In my father's first facility out in Marble Falls, which is a smaller town just west of Austin, very nice facility, wasn't a Taj Mahal by any stretch of the imagination, but he was well cared for. I would go out and see him when I was over in Austin, and I would notice that there were people younger than me, that were younger than 50 in this facility. And I got to asking some of the nurses and some of the attendants there, and they said, this person had a stroke, or this person was in a car accident, and their family couldn't take care of them or provide care. They had to be put into a nursing home facility. So it was surprising to me that it wasn't just filled with people 80 years plus. There were younger people in there. So you don't know what the future holds, but you can take care of it and prepare properly for it. And some of those myths, and we addressed a little bit of this in the pop quiz that I gave you, is that long-term care is covered under your health insurance. I can assure you that your school insurance or any insurance that your spouse has does not cover long-term care, especially once you reach the point to where you don't improve, meaning that you maybe had a surgery or something like that, and you're not back up on your feet, and you're never going to get back on your feet, for lack of a better term, as well. Health insurance does not cover long-term care. Medicare does not cover all long-term care costs, and we're going to cover that in just a moment and show you how that works and dispel that myth as well. Some people confuse or equate Medicare and Medicaid. Those two things are totally separate, and they're not designed to cover long-term care. And some people think they're too young to purchase Medicare, or should be too young to purchase long-term care and some type of extended care coverage. In most cases, you're not too young to purchase. We've oftentimes seen that there are people in their 20s that go on to some type of long-term care. The good news is the cost is much less expensive, easier to qualify for, and but you're never too young to buy, for lack of a better term there. We talked about where these services are provided, and it was always positioned to me when I was growing up, why would you want to work all your life and have somebody else determine where you're going to get taken care of if you need care? A good long-term care plan doesn't necessarily mean that you have to go to a nursing home. You can get cared for at home, in the community, like I told you, those continuing care communities, assisted living facility. And then if you have to go to a nursing facility because you need skilled round-the-clock care, you have that ability in there as well. So services are provided all across the board. To give you a look at nationally what the cost of care is, we went out to Mutual of Omaha, and Mutual of Omaha is the provider that is endorsed by PET for long-term care. And you can see out there all different levels of care and what those costs are. A home health aide is about $25 an hour. We're noticing that's going up because of the cost of gas these days. And the more rural that you are, the more costly it could be to get someone out to take care of you. It's about $25 an hour for a home health aide to come out and take care of someone on an 8-hour basis. Assisted living facility, to live in your own private room, about $5,900 a month across the country. Then you move into a nursing home facility with skilled care around the clock. You're looking at a semi-private room over $108,000, for a private room about $123,000. Now in Tennessee, you're blessed that it is less expensive. I was surprised that across the board, across the state, rates didn't vary too much. For a home health aide, you're looking at $4,200 to $4,700 across the state. And assisted living, a little bit cheaper in Nashville compared to Chattanooga and Memphis. Nursing home, you start to see a little bit different differentiation. Sometimes it's because there's not as many facilities in the area. And so therefore it could cost more because there's not as many beds that are available out there. And then you get into a private room, it can cost significantly more than a semi-private room. I would encourage you to go out to genworth.com, GENWORTH.com, and look at their cost of care widget on their website. You'll scroll down on the homepage and look at their cost of care widget. And you can plug in the city, you can plug in a state, a zip code, anywhere in the country, and it will give you example pricing of what home health aides, semi-private room, private room, assisted living facilities are in that area. So if you want to price it out for your parents, for yourself, just to get you a cost estimation of what it could be. As I mentioned, my father was in 2 different facilities. His cost was around $6,000 a month for a semi-private room. It was in a nice facility with very good staff. It wasn't a Taj Mahal in terms of newness or anything like that, but he was well taken care of. So $6,000, we were thankful that he had taken out a long-term care policy that took care of all that for him so that we didn't have to worry about it from a financial expense. As I mentioned, Mutual of Omaha is the preferred provider of PET's long-term care plan. They gave me some stats that said the average age of a person who goes on claim is 78. So think about your parents. But the youngest person that they have on claim is 27 years old, traumatic brain injury. So again, you can see there's a wide range out there. Women far more than men go on claim, simply because more women take out long-term care coverage because they expect to live longer than men. And because most of the time, as I mentioned before, the wife stays at home to take care of the man as long as possible. And then when that's no longer available or the husband passes away, then the woman has worn herself out and she has to go into a nursing home facility herself. The top 3 reasons that people go on to claim with Mutual of Omaha's long-term care policy are dementia, heart disease, like heart attack, something like that, and arthritis. And that kind of surprised me there. Arthritis, where the point to where you can no longer painfully move your joints, maybe move, even get out of bed because of arthritis, is in the top 3 reasons why people need to go on claim to receive some type of long-term care. So it really boils down to, how are you going to pay? And we're going to jump into this a little bit because what's most uncomfortable about this conversation is we see oftentimes people, even with a long-term care plan, do not understand what's going to come out of their pocket before their long-term care plan kicks in. And that's why we have this conversation, so that you're aware of that. You can use your savings. And especially as an active educator, you may have a 403B, your spouse has an IRA, or you've got some money that you've put aside just for an emergency. Some of that money may be in a CD. Some of it may be in a tax deferred account, like the 401k, IRA, or 403B. And you have to sell those assets and trigger a taxable event or get a penalty on a CD. Or if you had to sell those assets or cash those assets out, and we've just had, stock market drop by 10%, your assets are a lot less. You don't have the chance to regain those future earnings that you're going to need for your retirement, that type of thing. Sometimes we see, especially in rural communities, Tennessee, the South, throughout Texas and Oklahoma, you've got family land that you may be hoping to pass on to an heir or your parents, but they have to sell that asset to provide care out there. That's unfortunately one of the ways that people have to pay for their own care. Some people talk about Medicaid, and we talked about that. It truly is a last resort program. Most educators do not qualify because of their compensation, because of their pension. They just don't meet the poverty requirements, because they require you to spend down, your assets to a very low point to qualify. And they have a significant look back period, meaning that if you tried to spend down your mom's assets, sell the house, sell everything she had, transfer it to you and your brothers and sisters, that they have a 5-year look back that says, did you do this in the past 5 years? Your mom is no longer eligible for any type of Medicaid because you didn't do this long enough ago. She's not truly destitute. You were simply doing it to get into Medicaid. And then even if you do qualify for Medicaid and the state puts you in a Medicaid facility and provides for your care or your parents' care, after you pass away or your parent passes away, they'll go back to the estate and try to seek reimbursement for what they paid. So again, Medicaid is very difficult. So people always say, well, my parents, or I'm close to being on Medicare. How does Medicare work? And I want you to write these numbers down, because I want you to be very clear on how Medicare works for your parents or when you're eligible for Medicare. Medicare will pay for long-term nursing care if you have been in a accident, had a procedure where you need skilled nursing care after a 3-day hospital stay. Okay. Once you've had a 3-day hospital stay for a qualifying event and you need skilled nursing care after that, Medicare will pay for the first 20 days 100%. So let's just kind of put this in perspective, or think about it in an example. Your mother slips and falls and breaks her hip, and she goes to the hospital. The procedure calls for at least a 3-day hospital stay, and she's going to then have to have rehabilitation in a skilled nursing facility to be able to get back walking and taking care of herself, dressing, feeding, bathing, that type of thing. Once she's discharged from the hospital, she will go to a rehab facility, or someone will come to her home to help her out. Medicare will pay for the first 20 days, 100%. After that, she is going to be responsible for everything above, she will have to be responsible for $185 a day. It's now $194 a day in 2022. It's gone up. She'll be responsible for $194 a day of her care up to 100 days. Medicare pays all the rest of that during that remaining 100 days. After 100 days, Medicare stops paying, period. So as you can see, there's really not much Medicare coverage after 100 days. I showed you that stat that over almost half of people who go into a nursing home leave before 100 days. It's simply because that Medicare stops paying out there. And now here's what's even what I call more insidious in the way that Medicare tries to get out of paying for any type of long-term care. They do it by the way that they classify procedures. And they do it because of what they call inpatient care or observation status care. Okay. Remember, I told you to write down 20 days, 100 days. I want you to remember that 3-night hospital stay. Medicare classifies every procedure in the hospital by a code, by a medical code. And that medical code tells what they can expect to pay for, what type of procedures, and what type of aftercare is prescribed. If a medical procedure has a code that says this is an inpatient stay, and you need skilled nursing care after that inpatient stay, then you have those Medicare benefits for that up to 100 days. However, if you're in the hospital 3 nights, but that code does not say inpatient stay, even though you spent 3 nights in a hospital, you're in observation status, even if you need skilled care afterwards, there's no coverage because you're an outpatient. And what Medicare has done is every year they move thousands of medical procedures and those billing codes to outpatient status. It doesn't mean that Medicare doesn't pay for the procedure in the hospital. It doesn't change what the hospital does to help you get better, provide the care, the service, the procedure, the surgery, whatever it is. You can still say the same 3+ nights. So you play 7 nights in a hospital. But if it's classified as an outpatient or observation status, you get absolutely no skilled nursing benefits after you leave the hospital. Very important to understand. Something that we've had many times, people that will have a knee replacement surgery several years ago, stayed 3 nights, got the skilled nursing care after that to get back on their feet. Now they go in this year and Medicare has changed that procedure to an outpatient procedure and don't get those same skilled nursing benefits after the fact. They do this, and it's not just joint replacements, it's heart procedures, stroke procedures. So many different things are classified as outpatient now. It's a way that Medicare saves billions of dollars every year, not having to provide this coverage in terms of skilled nursing care after the fact. So it's important to understand that for you and your parents, because it does impact when and who pays for certain care out there. And unfortunately, this stat really hits home here from the standpoint of that 73% of all long-term care is ultimately provided by a family member who has no formal skills and receives no compensation. I work with several people that are retired educators or teachers who had to leave the classroom long before they were retirement eligible, that had to leave earlier than they expected because they needed to take care of their mother, or they needed to take care of a grandmother who had long-term care needs but did not have a long-term care plan to provide for that care. And since most teachers are women, that can greatly impact your pension in the future. It can greatly impact your savings to put your kids through college. It can greatly impact your ability to have income that you need for your family now. You see those stat numbers down there. A female loses a woman who has to leave work early to take care of a family member, costs them $300,000+ a year, or not a year, $300,000 over their lifetime of income that they may have been expecting to provide for their family. And it goes beyond to just the financial aspects of it, the stress that it puts on a family, the stress that could cause marriages. I've seen divorces come out of this by having to take care of a parent. That can impact the children and the grandchildren, holidays and things like that. So I encourage you to look at some sort of a plan for yourself and your parents to make sure that you don't have to worry about this. We were so blessed again because my father was able to purchase this plan back when he was early 60s and used it whenever he needed to, that my stepmother did not have to do anything different. She stayed in the living conditions that she was used to and was able to take care of my father in his final years there. A long-term care policy could be another solution. It can supplement any out-of-pocket expenses that you may have, help you pay for your long-term care expenses. It can protect those assets that maybe you were planning to use to take care of the rest of your family or pass down to grandkids, something like that. Most importantly, it allows you to stay connected to those things that matter most. A good long-term care plan can keep you at home. And to me, that's the most important thing. A good long-term care plan can give you stay-at-home benefits that has somebody come out and does that lighthouse work, cleaning, meal prep, those personal, uncomfortable tasks that maybe you don't want a son or daughter having to do, like bathing or dressing you or wiping your backside, things like that. It can pay for that. It can pay for a skilled nurse to come provide home health aid skills or physical therapy or wound dressing, things like that. The thing I like most about long-term care plans, they can help you modify your home so that you can stay at home. If all that means is getting you some pull bars in the bathroom or a lift or something like that, or wheelchair ramps outside of your house or widening a door, long-term care plans will help you do that so you can stay at home. And so that's what really we all want to do if that's available to us, is to stay at home, and a good long-term care plan can do that for you. You can choose your benefits with certain long-term care plans. You can choose a lump sum cash of benefit with no elimination period that just says once you lose your activities of daily living or diagnosed with Alzheimer's or dementia, boom, here's a lump sum of money that you can use however you want to there, to pay any cost that you want to towards your long-term care. Some plans are reimbursement plans, which means that once you start to know what your expenses are going to be, they'll just reimburse the care provider directly up to the maximum monthly benefit amount. And you don't have to worry about the bills or anything like that. Maybe you just have to pay for anything over and above that comes that way. So there's a lot of different ways that you can structure your plans out there. But it's important not to wait. This study shows here, the longer you wait, the more difficult it is to qualify. There's not as many long-term care providers as there used to be out there. So they're getting tighter on what their family history requirements are, or history of a fall, or history of cancer, things like that, and making sure that it's more difficult to qualify. The longer you wait, the less chances you have of becoming qualified for coverage. And it gets more expensive the longer you wait. Don't worry about the annual premium amounts. This is just a look at a female, just a generic look across the country. They're all based on ages, based on locations, things like that. Just basically shows you if you wait, the longer you wait, the more expensive it is to cover you out there. There are other options. Some people say, well, I'm not sure if I've got long-term care coverage, or I do have some plans, but I don't know if I've got the type of coverage that I need. There are different plans out there that can protect you in terms of length of coverage. If you need a shorter period out there, my brother and I have a plan for my mom that basically says it's going to provide a non-skilled person to sit with her or to do a light housekeeping, take care of her for at least a year. That would allow us to get her finances in order if she then had to go into a nursing facility. So you can shorten your period of coverage if you want to. You can look at weekly and daily benefit amounts up to $1,300. You can get a zero elimination period, so there's no money out of your pocket, or you can get a short-term plan that covers your elimination period on your long-term care plan. Location of coverage, you can get coverage that's just at home or just at a nursing facility, and then you can get those non-skilled services like I mentioned, because it's so important to be able to take care of somebody where you want them to. And I want to be able to maybe have somebody take care of my mom that I feel comfortable with. And if they don't have the skills in terms of some type of skilled nursing licensing, I can still pay for them and have that covered by her type of plan that you've got out there. So there are a lot of options for you. So we're going to talk about how you can get those options in just a moment. Just a couple of quick reminders. We have a couple more webinars to finish out this series. We're going to talk about emergency transportation issues in Tennessee next week, and then come back in a couple of weeks and talk about the true cost of a cancer diagnosis. Make sure you pay attention to the webinar emails out there. Sign up for the registration as well. And tell your coworkers about these PET webinars. Let them know they're out there on the YouTube channel. They'll soon be on the website. They can sign up and view these live, but help them to understand what PET does on your behalf, and help them become members of PET and take advantage of all of the development benefits, all of the advocacy and support that they provide you as educators. And share these videos with your family members. Have that discussion now. Don't wait until it's too late to have the discussion with your brothers and sisters about how we're going to take care of mom. So just a quick wrap up here. If you've got any questions, if you want to learn more about the benefits that you have through PET, all you have to do is simply open up your smartphone, hover over that with your camera feature, open up your camera, hover over that QR code, a little form will pop up. You can select long-term care, you can select home health care, you can select whatever you want to talk about, fill out the information there, and we'll respond back to you very quickly. If you don't have access to the QR code or to a smartphone, you can simply email me at john.green@amba.info and just let me know what you're interested in. We can have someone contact you as well and talk about that. So thank you very much for joining us on today's conversation. If you have any questions, feel free to email me. I'll be glad to take care of those for you. And at this time, have a great rest of your day and a great rest of your week. And we look forward to talking to you very, very soon. Thank you very much for joining us.